Hello, everyone. This is Ty Stockton. I'm the Communications Manager with the Department of Workforce Services. I'm going to give it a little bit of time here. I think we've got some folks trickling in through the waiting room into the meeting, so I don't want to get going before everybody's here, but thank you for joining us for this week's Town Hall, which is on safety in the workplace. You can probably see on your screen right now, we've got a few numbers in case you have any questions about occupational epidemiology, Wyoming OSHA, or labor standards. We've got those offices are housed in DWS. And we have representatives from each of those here to talk to you today to give you some information about how to make sure that your workplaces are safe in this very weird time. And, you know, with all the changes and the stops and starts, it might be a good time to kind of refresh your safety protocols and make sure that everybody's on the same page. So we've got from occupational epidemiology, we have our occupational epidemiologist, Meredith Toll. She'll be here to talk to you a little bit about some of the things that she does, and she keeps track of injuries and fatalities in the workplace and tries to recognize trends and help you figure out ways that you can prevent those. We have Karen Godman with Wyoming OSHA, and then we also have Joshua Taylor. I'm sorry, I'm a little frazzled this morning with all this COVID stuff going on. But Joshua Taylor, he's our new head of labor standards. So I've got those three folks here to talk to you about some stuff, give you a little bit of a presentation, and answer your questions. If you have any questions, if you kind of hover your mouse over the screen, it probably goes away if you don't have any movement on your screen, but hover your mouse over your screen and a little Q&A box will pop up at the bottom. Click that Q&A link and ask your questions in that Q&A, and we'll get to those questions when we get to the Q&A portion. If we don't get to everybody's questions, we can pull those questions after the meeting, and we'll answer those questions and post them on our Town Halls page on our website. And our Town Halls page has a link straight off of our homepage on our main website at wyomingworkforce.org. Over on the right-hand side, there's a link to Town Halls. And later on, I can share my screen and show you where that is. But if you click that, we actually have all of the recordings from all the Town Halls and the questions that were asked and the answers to those questions all linked on that page. So if you have any questions, those are all right there. But I'm going to turn this over to Meredith to get you started with the occupational epidemiology, and she's got a presentation, and I'll pull that up and we'll get rolling with that. So Meredith, over to you.
Thanks, Ty. Yeah, good morning, everybody, and thanks for joining us today. Again, my name is Meredith Toll. I'm an occupational epidemiologist here at the Wyoming Department of Workforce Services. My goal today is to provide just some context to the COVID-19 pandemic and also some resources and points of consideration for you all as you're re-engaging with work in the community. My presentation does have quite a few web links in it, so as Ty mentioned, this presentation will be available to you on our website after the webinar today. Okay, next slide, Ty. So I'd like to share with you all what I think is one of the best graphics to put the scope and urgency of the COVID-19 pandemic into context. These data come from a surveillance system that captures virtually all deaths in the US. It's a long-standing system that's been vetted and very established. So what you see is the percentage of deaths in the nation that are attributed to pneumonia and influenza and now COVID-19 illness. The blue shaded area represents flu and pneumonia mortality, which generally accounts for about 6 to 8% of all US deaths in any given week. 2018 was a particularly bad flu season, which is observed in that 10.9% mortality spike. COVID-19 quickly amplified mortality as seen by the yellow shaded area. At its peak in mid-April, over 25% of all deaths in the US were attributed to pneumonia, influenza, or COVID-19. The good news is that the amazing efforts of our public health and healthcare systems and all of our everyday actions to reduce the spread have brought that proportion way down. These data have been updated through May 30th at my last look and have continued that downward trend. Next slide. So looking at the current burden of COVID-19 in the US, this is as of yesterday. I think the big take-home message here is that the full picture is yet to be realized. We currently in the US have a death toll that far exceeds our worst seasonal flu experience, and we continue to see hundreds of deaths per day nationally. The hospitalization rate is estimated from a select consortium of states that are participating in that data to be about 82 for every 100,000 persons. That may seem like a small number, but it's actually a pretty significant number in the world of epidemiology and the things that we track. All of these measures, especially the illness case count, are likely underrepresentations of the true burden of COVID-19 due to limitations in our tracking systems and the limitations of testing early on in the pandemic. Next slide. So looking at the risks for severe illness, we've all heard that older adults are at increased risk for severe illness. And here is where that trend becomes very clear. Based on these national data from, again, a select group of states, it's about 14 states that are participating in this particular data set. COVID-19 hospitalization rates incrementally increase with age, with the first big jump occurring in the age group of 50 to 64. People age 50 and over represent about 1/3 of the working population in Wyoming, which really highlights the importance of prevention in the workplace. This same data source of hospitalization information has also revealed that certain racial and ethnic groups have higher rates of COVID-19 hospitalization, likely due to various socioeconomic factors, and that people with certain underlying health conditions are at increased risk for severe illness. The most commonly reported conditions in this data set are hypertension, obesity, chronic metabolic disease, and cardiovascular disease. Next slide. So how do we navigate this new normal? It's been tough for many, including myself, I admit, to acclimate to living through a pandemic. We live very full lives, we have jobs, we have a need to engage with the world around us for our health, our well-being, and our economic stability. So the days can feel full of difficult choices, and where do we begin? The first step that I'd like to encourage is always to abide by the public health orders. These cover the topics like gathering restrictions and rules for certain settings and businesses. And as you probably have seen, the current orders expire on June 15th, and a new order will take place, and those have been posted on the health department's website. The second step would be implementing as many of the public health recommendations as often as possible. These include the recommendations for hand washing, sanitizing, face coverings, cleaning, staying home when you can, all of the things that reduce potential exposures even further. And from here, we can further inform our decisions by considering local data on community spread. The more spread that we have in our localities, the more cautious we need to be. And that data, again, is posted on the Wyoming Department of Health's website, and the link is in this page. We can also do our part by staying educated on the science of COVID-19. We're still learning every day about transmission, treatments, vaccines, and the effects of illness. And again, another link in this webpage is, or in this slide, is to the NIH. I think that's a great website to really stay on top of all the science and virology of COVID-19 as it rolls out. We also need to always consider the potential risks of our actions. And we're not talking just the risks to your personal health, but also the risks posed by others by our actions. And finally, being ready and willing to adjust strategies as needed. We all know that change has been one of the very few constants during this whole situation. Next slide. So I want to go through a couple key steps for employers on the next slide. There are, as you know, countless checklists and guidelines available, but they all come down to some very common principles. First, identifying potential COVID-19 exposure is a critical first step and will be discussed more later in this presentation. Supporting employees to recognize the possible symptoms and staying home when ill is also very essential. And this includes the strategies like employee screening, teleworking, flexible scheduling, or paid leave. Helping employees and customers maintain adequate distance. We all know this strategy. Providing for adequate hygiene, cleaning, and PPE or face coverings as needed or as appropriate. These things must always also be accompanied with training and communication, which are especially effective when paired with mechanisms for feedback and response. And lastly, it's important to take time to think about how COVID-19 precautions may interfere with or even enhance existing safety protocols and adjust accordingly. Always consider the need to retrain and reorient staff on existing safety protocols. Next slide. As you likely know, I want to talk about key public health resources on the next slide for workplaces first. So as you likely know, this list of resources doesn't even scratch the surface on what's available, but they are primary and credible sources of information that you can rely on. The occupation-specific resources here are incredibly helpful to help translate recommendations for specific settings. These are the CDC's specific resources. Our Department of Health has a couple specific occupation and workplace-specific resources posted, as does OSHA. I also really like the general business FAQ that's been posted by the CDC. It covers a host of scenario questions and can help employers and safety professionals prepare and respond to COVID-19 issues in the workplace. Next slide. And then finally, I just want to mention some key resources for everyone. I just want to leave you all with a reminder to give grace to yourself and give grace to each other during this very challenging time. Many of us are facing new levels of stress and fatigue, but support is often a click or a call away. And I do think that this kind of information is really important to share with your coworkers and your employees to make sure that people know that these are real issues that we're all coping with. And it, just to sort of encourage people to reach out if they're needing a different level of support than usual. And with that, I'm going to turn it over to my colleague, Joshua Taylor from the Labor Standards Office.
Thank you very much. And good morning to everyone. So and before I forget, that was an excellent presentation. I really do, before I forget again, the information on burnout and fatigue, I highly recommend to people in these times. I think it's, and I'll get into this later, I think during this pandemic, it's easy to go, my personal concerns aren't important. And I would just emphasize on a personal level, there are your needs in this time of increased stress. You should be aware of how it's affecting you. But to the point at hand, labor standards. So labor standards is a broad term. And I think a lot of people, when they hear it and they say, hey, this is, these are the people we go to for worker safety and the like. And I'm here to tell you that that's somewhat true. OSHA is probably more pertinent to that than labor standards, but labor standards, our focus is, are you being discriminated against, and whether or not you are getting paid, basically, for the wages that you're owed. That's our two of our primary areas. So with that in mind, labor standards, what we operate to do in short is to make sure you're not being discriminated against based upon race, color, religion, sex, national origin, age, or disability. And you might be asking yourself, how does that pertain to disability? Thank you, Ty. Disabilities during a pandemic oftentimes are going to make you particularly vulnerable, right? If you have a disability in regards to, say, breathing or, anything with the lungs, say you have some medical treatment or impairment there, uh, your employer, we come back and say under federal law and local law, has to make reasonable accommodations, and that are not an undue hardship upon the business. In that respect, we go, hey, we try to work with you, and your employer should try to work with you as well. And if you're asking yourself whether or not you have a disability that qualifies, well, here's the definition. Wyoming state law does not have a statutorily defined disability definition, by the way, but we rely upon the federal definition, which includes a physical or mental impairment that substantially limits one or major life activities of such an individual, or a record of such impairment, or being regarded of having such an impairment. And of course, there's more. You can look at that citation, of course, to see that additional descriptions and limitations in regards to being regarded as having an impairment. But if you and your employer agree that we think you have an impairment, like I said, they should, if you request it, they need to make reasonable accommodations for you. And this goes back to my earlier point, particularly when it comes to disabilities that might make you susceptible to, particularly to COVID-19 and the illness. Say you have asthma and you won't be able to wear a mask, and your employer's asking you to wear a mask. Well, they gotta be reasonable with you and try to work with you to make other accommodations to where you can continue your job in your employment. This also goes back to the other point at the beginning. I said, hey, in this time, let's keep in mind burnout and fatigue, and your personal well-being is important. And I realize it's in this time that we see in the news, oftentimes we're seeing high rates of unemployment, and more news, and we have other turbulence going on. You might be feeling some social pressures to go, hey, I don't want to raise my concerns, my feelings about maybe I'm feeling I'm being unfairly treated upon the basis as I iterated earlier. So I'm not going to raise it. Well, I would say that that attitude, completely understandable, but it makes people ripe, I will say, for maybe some mistreatment under the law or some exploitation. And that's why I would say, hey, keep this in mind, particularly now, when all of us might be going, hey, we're not really paying attention to these areas of discrimination that we might pay more attention to in less turbulent times, and when we're not so distracted. And so we are here to step in on your behalf and say, no, that's no matter the circumstance, it's important even in the good times, and more important during the bad times, that everyone get equal treatment and equal opportunity. And that's where we are. In that regard, we also, I mentioned it at the top of my presentation, we also enforce wage and hour claims. That is, if you feel like you have worked hours, and you are not being compensated for that work, then we listen to those claims as well. And thank you again, Ty. He's reading my mind. Here before you are those two links where you can make those complaints to us, raise those concerns. There's the wage and hour claim. You go on and you have an electronic claim form right there before you that will give us the pertinent information to start looking into your claim. And then we also have documents, unfortunately, because we require I should say, state law requires a verified complaint. That is, you have to sign you have to have someone notarize your complaint to us for discrimination purposes or on discriminatory grounds. We have the documents that you need to fill out, and you need to have them notarized, or you need to get that information to us so we can send you back those documents that need to be notarized. And that's what the link is for the fair employment issues there. So once again, I'm going to reiterate to you all this. These are turbulent times, and to keep your all's heads up, and don't be afraid to step forward and say, hey, someone or something, some institution, some individual is treating me unfairly, and to raise that issue before us. In particular, I would say be aware of disabilities at this point, and whether or not you have a disability that makes you particularly susceptible to COVID-19, and you're requiring some further reasonable accommodations that normally would not seem needed, if you will. So with that, I'm actually going to, well, speaking of safety at work, I'm going to pass you off on the folks. Oh, and just one last thing. Don't worry about complaining to us or raising an issue to us, because your right to come and report to us is protected. Your employer cannot retaliate against you or take an adverse action against you for coming to us. You are always entitled to come and speak to Labor Standards, the Equal Opportunity Commission, who we work for. That's the federal side of things. We have a workforce share agreement with them. So we enforce both the state and federal laws in this regard. Both state and federal law protect you for coming to us. Those have not changed. So with that being said, I'm going to hand you off to the experts on workplace safety, the OSHA individuals, and particularly Ms. Godwin. And thank you for your attention this morning, and stay safe and healthy.
All right, well, thank you, Joshua. And thank you for joining us. My name is Karen Godman, and I am the administrator for Wyoming OSHA. And what I'd like to do is just touch on a few things. It's important to know that OSHA does not have a specific standard for COVID-19, but there is guidance to assist in preparing a workplace for COVID-19. So I wanna kind of explain that. Right now, there is not a current standard, but employers are still expected to protect their employees. So we're gonna kind of go through how an employee and an employer do that. So an employer is required to assess risk in the workplace for employees. And that means taking a look at what job tasks that employee conducts, what kind of interaction with the public that employee does, and implementing certain controls to try to protect those employees from a potential exposure. So on this presentation, you're going to see that there is a slide called Worker Exposure Risk to COVID-19. I'm not going to go through every section of it, but basically there are 4 risk categories that an employer can look at. And there's lower risk all the way up to very high exposure risk. So those risk classifications are going to be something that your employer looks at for the space that you're working in and the job tasks and classifies. So most places are going to be a lower to medium risk, but some of the high to very high risks are going to be for people that are providing medical services to people that have COVID-19 or doing certain processes. So I want to explain a little bit about that. There are risk classifications, and the employer can use this document to classify that risk. And once they do, then how do you protect employees? So what we're going to do is we're going to talk about what kind of controls can an employer put in place to protect employees from a potential exposure to COVID? So the controls that we're going to talk about are based on a hierarchy of controls. What does that mean? That means that we want to look at trying to protect employees in certain ways. And the best way to do that is to engineer it out. So that means putting in certain controls that will take out that exposure risk all the way down to using personal protective equipment. Now, it's really important. You're going to hear a lot of talk about people wearing personal protective equipment first. And that's really not what we want to do. If we can engineer out the risk, that's what we want employers to do. So take-home message is we want to start with engineering out controls all the way down to wearing personal protective equipment. And that's what this picture is showing you. Okay, so let's talk about that control. Engineering controls are going to be the first type of control that an employer can use and should use. And an example of that would be an installation of a physical barrier. So we have a fence up here, which is great because it gives a good idea of what we're looking at, something that we can physically put in place to protect an employee. So a good example would be like plexiglass. When we go to the grocery store and you see people working behind the counter with plexiglass between you and them, that is a physical barrier. And there are a lot of others, but I think this is a really good example that we've all experienced during this pandemic and can relate to. So an engineering control would be something that we can put in place to eliminate that exposure. And it's not something that the employee has to try and figure out or put in place or wear. The employer puts it in place and it protects them. Okay, an administrative control. So administrative controls are going to be things like basically to minimize contact between individuals. What does that mean? A lot of people are teleworking. A lot of people have become very well acquainted with Zoom and alternating schedules. So for example, in a building or in a work group, maybe you work on Monday and I work on Tuesday. That way we're not interacting and we're reducing that face-to-face contact and basically reducing exposure in buildings and to our team. And the last thing that we want to do is personal protective equipment. I know we hear about this a lot. I know that this is something that seems to be the answer, but it's not. This is the last thing we want to do. So personal protective equipment, or PPE, is going to be the implementation of things that the employee wears, okay? So let's go back to the grocery store. You're buying a product, I'm working behind the counter, there's plexiglass between us because your employer is great and put in an engineering control, but then I'm wearing a face mask, respirator, gloves, and some other things to protect me, but also to protect you. So at that point, that's where the employee is trained by the employer on the expectation to wear personal protective equipment. This is what you wear, this is when you wear it, and I'm gonna provide it to you because I am your employer. And I'm gonna train you on that. How do I do this? It is the employer's obligation to train you on the expectations for that. So just a quick recap, an employer does the risk, they then choose the controls, and then based on that, you're trained on what is expected. Okay, so there are some directives and requirements that apply to COVID that you need to know about. I did explain that there's no standard, but there's big picture things that still are important for you to know that OSHA does enforce. So we do have specific directives, and those directives are for reporting. So that means if someone were to acquire COVID and they think that it's work related, they have to report it and they have to record it on a specific form. It's called the OSHA 300. I'm not going to get into that. But if you have questions, you can always call us. And then the last thing is respirator use. Okay, so for respirator use, again, there's going to be specific directives for certain industries that have higher risk. That's really important to know. So the respirator use directives are for healthcare individuals, okay? And they are the ones that are performing specific processes for people that are suspected or confirmed to have COVID-19. That's not for the general public. That's not for every industry. That's not for you know, construction workers. That is for people that are in specific industries, i.e. healthcare, emergency medical services, that kind of industry that are expected to have more potential exposure because of the kind of work they do. So I just want to kind of outline that. So those are going to be the three big picture directives that all industries just need to be aware of that apply to them. And also, just as Joshua was discussing, there are rights for employees, and employees have the right to report health and safety concerns to OSHA without retaliation. That includes concerns about COVID. So what I mean by that is, if you have concerns in your workplace that your employer is not providing a health and safety, you know, ensuring your health and safety at work for COVID, you can file a complaint with our agency. That is your right, and you cannot be retaliated against for doing that. So where Mr. Taylor was discussing, you can always file, you know, a complaint if you have concerns about discrimination. You can also do the same with OSHA, but OSHA is only about health and safety. That's the only kind of discrimination that we look at. So if you feel that you were discriminated against because you filed a health and safety complaint with OSHA, or you brought something to your employer about health and safety in good faith, and you lost your job, you had a reduction in hours, you had a reduction in pay, those are the kind of things that OSHA does investigate for discrimination. But if you have a concern, please give us a call. And what we would do is, if it does not fall in our jurisdiction, we would make sure to share that with Department of Labor. So just know that if you have a concern, you don't have to figure out exactly where it should go. You can call us and we will work with you to try to either investigate it or make sure that you have the right resource to help you with remedy. So with that, we know that COVID information and resources change frequently. We see it on the news, we see it on the internet, we see it in press releases. But what I want you to know is we do have a very good resource that is updated constantly on our website listed below. And we are always sharing information on COVID-19 changes in OSHA rules and regulations or directives, or maybe just guidance information that you can use. So please just know that that is there and that you can access it anytime for the most recent information that we have. And of course, you're always welcome to call us as well. We have resources for you. With OSHA, we do have a compliance section and a consultation section, but the consultation section is an opportunity to ask a question. It's confidential, it's free, and we work with you to try and answer questions or help you in that journey towards how you want to have employees return to work. So thank you so much for your time. If you do have any questions, please feel free to contact us. We're happy to work with you.
Thank you, Karen. And as everybody has stated, you know, we're here to help with all these situations. If you need help making sure that your workplace is safe, if you're an employee who's got some concerns about the safety in your workplace, we're all in this together. So we're here to answer your questions. I'm gonna go back to that slide that has all the numbers on it, and you can call any of those numbers if you need any information with any of this. And now we're going to turn over to questions and answers. Right now we just have one safety and workplace question. If you have more questions, please use that Q&A feature down at the bottom of the page. Again, you might have to hover your mouse over it to make it pop up. But we've got one question that asks, how do you reconcile, and this is probably a question for Karen and Meredith, how do you reconcile the OSHA guidelines with the public health orders? They don't always mesh together, but you can be cited for either of them in different ways. Karen or Meredith, would you like to answer that?
So Meredith, would you like to start with the public health side?
Sure, I'd be happy to. Thanks. So public health agencies, you know, they do have the authority to administer public health orders, that have the intention of helping to control or contain threats to the public health. And so these orders, as you all know, they do, they include things like business closures, limitations, and even, quarantine and isolation for certain individuals. The current public health orders for COVID-19 have very clear directives on certain aspects for certain businesses. So things like adequate distance between non-household members, face coverings in certain workplace settings, placement of hand sanitizer, employee health screening or symptom screening, or even screening of close contact with COVID-19, people that have been diagnosed with COVID-19. They have directives for recording staff attendance and screening, and signage. And I don't want to go into all the details of these different orders because they are posted online, and they are, they're pretty lengthy. So I will just say that I know that the orders currently cover numbers of gatherings, number of people that can gather in different types of settings. They cover bars and restaurants. They cover some personal services such as hair salons, tattoo parlors, and they provide the orders also cover daycare settings as well, childcare settings. I can't speak to enforcement of these. I don't work at the state health department. I work here at Workforce Services. So these public health orders are the legal authority of the state health department. And enforcement is really up to them, and I'm not going to speak to that. It may also vary based on locality, depending on the capacity of the local health agency at the county level. But I do want to mention that these orders it's a longstanding practice in public health when they're needed, and they're based on the epidemiology of a condition and also the science. And in the case of this pandemic, the orders are really focused on what we know of the epidemiology, because that's the early information that's coming to us as we continue to learn more about the science. So I hope that addresses the public health component, and I'll turn it over to Karen to talk a little bit more about the OSHA component.
Thanks, Meredith. So OSHA is really about employer-employee relationships, and it's very important to understand that OSHA has directives and information for employer-employee relationships, whereas what Meredith just explained is public health orders are for the public, for everybody, okay? And so when we talk about OSHA information and reconciling that, again, OSHA does not have a standard that is enforceable for employers and employees, but there is guidance. So what I'm going to do is explain a little bit that it's going to depend on your industry, but in the big picture, OSHA is going to look at if an employer has conducted a risk assessment for their employees in the workplace and if they're implementing controls. So if there is a take-home message that I want to share with you, it is every employer should be assessing risk for their employees and implementing controls and strategies to protect them regarding COVID-19. So if there are any questions or concerns specific about OSHA information or what your industry does or what things would apply to your industry, please feel free to call our consultation department. We're happy to talk to you about that and go through the challenges that you have and what control strategies may work for you.
Thank you, Karen and Meredith. I appreciate both of you answering that question. We have another question regarding safety in the workplace. Are all companies required to log COVID-19 cases on their OSHA logs, even if the NAICS code is exempt from record-keeping standards? Karen?
Okay, Todd, I'm taking this one. Okay, that is a great question. And with that, it is important to know that the OSHA 300 form is basically required for employers to log different kinds of injuries and illnesses in the workplace. With this question, the answer is going to be If your company exempt based on NAICS code, or you have less than 10 employees, which applies to all industry, then no, you do not have to maintain and record that. But it is important to note, if you have a question about that, and if your industry applies, or if your NAICS code is exempt, or if that has changed, again, just call. We're happy to work with you on your industry, your NAICS code, and whether or not the record keeping for COVID would apply to you.
Excellent, thank you. If anybody else has any other questions that regard safety in the workplace, please use that Q&A feature. We did get one question that is not related to safety in the workplace. We don't have anybody from the unemployment division here today for this town hall. The question was, when is the PEUC going to be up and running? Our technicians are working really hard. They're testing that system. They've run several tests, done several iterations of it, and they're trying to make sure that system is up and running smoothly so that we don't overpay people and they have to pay money back, underpay people and they have to fight to get money. They're trying to make sure that it is absolutely correct. So they're getting that working. They'll have it soon. As soon as they have it up and running, we'll have that posted on our website at wyomingworkforce.org. We'll put it on our Facebook page. We'll send it out to the media. You'll definitely know when that is up and running. So they're working really hard to get that going, and we'll get that out to you as soon as it's available. Any other questions on safety in the workplace? We'll answer any more that come in, but if we don't get any more, then I think that's it for today. Thank you all for joining us. Joshua, Meredith, and Karen, thank you guys for taking time out of your busy days to come and answer these questions and present this presentation. And Jessica, who's in the background, put that presentation together, so thank you for that, and appreciate everybody who's taken their time to work on this town hall. We try to have a town hall every week. Usually, lately, they've been mostly focusing on UI questions, unemployment insurance questions, but we're trying to do these more often and get this information out to you. So if you have any questions, call those numbers on your screen. You can always visit wyomingworkforce.org. That's our main website, and we have all this information there. If you have questions about unemployment insurance, we have a frequently asked questions page that's linked off our main website. Then you can ask, you can find the questions and answers there as well. Thank you again. Appreciate you all tuning in. And then the recording of this and the questions and their answers will also be posted on that town halls page that is linked off of our main website. So just go to wyomingworkforce.org, and over on the right hand side there's a link to town halls. You click that and then you can find all the town halls we've done. So thank you again and have a wonderful day.